If you enjoy listening to career conversations, why not become a member of the Royal College of Physicians of Edinburgh? Our membership provides you with access to the RCPE educational portal, the live evening medical updates, and you have options to view the symposia both in person or online. If you would like to learn more about this, please go to the Royal College of Physicians of Edinburgh website.
Hi there and welcome to this episode of Demystifying PACES. My name's Emma Spencer and I'm an IMT3 trainee in South East Scotland, and I'm going to be hosting this episode today. I work with the Trainees and Members Committee at the Royal College of Physicians of Edinburgh, and we are a group of trainees who work to represent the views of those training in physicians' specialties. We also produce a lot of educational material, and this Demystifying PACES series is a mini-series in our Career Conversations podcast. Today we're going to be talking to 3 candidates who have recently passed their PACES exam about their personal experiences of preparing for the exam and sitting the exam. I'm going to ask them to introduce themselves one at a time. So if we start with Olugbenga Alabi, who's recently passed his PACES exam.
Thanks so much for inviting me. Surprisingly, you pronounced the name rightly. Yeah, it's Olugbenga Alabi, and I'm currently IMT2 in the Belfast Trust in Northern Ireland. I'm currently doing my oncology rotation now. Thanks for having me.
Brilliant, thanks so much. And then if we just introduce Aparna next.
My name's Aparna. I'm currently an IMT1 in East Midlands. Like Emma, I'm also on the Trainee and Members Committee, and I have an interest in dermatology. Currently, I'm doing my geriatrics rotation.
Perfect. And then we've got Yasmin.
Hi, I'm Yasmin Nikookam. I'm also an IMT1 trainee in South London, and I'm currently on my rehabilitative medicine paired with dermatology block at the moment, and I am also on the Trainees and Members Committee.
Brilliant. So we thought we'd start the episode by having a chat about how each of you prepared for the exam, whether this be the timing that you chose to sit the exam at in your training, or any resources that you used, or any particular techniques of revision that you used that you found helpful. So if we start with you, Olugbenga, just share any experiences there.
I think I'll probably start from the booking of the exam itself. I have a friend whom we were doing rotation together in ICU. And that was my second rotation in IMT2. And I said, let's book these exams together. And he said, he's not prepared yet. I was like, I'll just give it a try. And I booked for first diet in Jan 2023. And that's the first diet of the new PACES. And it was okay initially. And I think talking through materials, it quite depends on the nature of your own personal learning. I'm quite photographic. And if I see things, they tend to stay more than me having to read all through. So I have to use more visual-spatial materials. So videos and watching people do things, I can mimic that. So I think those are some of the things I did. Then I had to book the exam in IMT2 because I felt I've had enough exposure. As you know, I trained in Nigeria, Olabisi Onabanjo University, and having to come here to start IMT and then so I probably needed to integrate more. And so after my IMT1, doing all the part 1, part 2 of an RCPE, I was like, now I can face the clinical exam. So, and I also have to plan my rotation to suit the nature of the exam. So I ensure that I go through some of the specialties I may not have had exposures to so much. For instance, most medical students would not have exposure to dermatology, to rheumatology, which are things you could meet in the real PACES exam. So I had a 3-month experience in rheumatology in my first rotation. And luckily, I saw my station 5 were rheumatology cases completely. And these were things I was seeing on the ward. So it was like I was just having a chat with my consultant on the ward in Musgrave. But that was the way. And I used some paid resources material, some websites, which you would also mention in the course of this podcast.
Yeah, brilliant. I think that's really key, isn't it? Thinking about when is a good time in your training according to particularly key rotations that you've done. And a rheumatology or dermatology rotation is a great experience that not everyone gets and can be very relevant. Aparna, did you have a particular reason for picking the time that you did PACES, or any standout materials or preparation methods that you used?
So I sat my exam at the very start of IMT1. It was the first sitting of PACES available to me during IMT1. And my reason for that was mainly just so that I could get the exams done and out of the way as the compulsory thing for training and to get into a HST. So I just wanted it out of the way. And I also thought that the knowledge and skills and professional capabilities which you acquire during the process of revising and preparing actually bodes you well during the day job. So that was my main reasoning for sitting it then. And I also had quite a few medical rotations during FY1, FY2, so did have a bit of clinical experience as well. In terms of revising for the exam, I don't recommend this, but I didn't have very much time just because I booked the exam in July and then we got the kind of exam date at the end of August. And then my exam ended up being in October. So I only ended up having 6.5 weeks, which was very stressful. And it goes without saying, but along with juggling that with commuting to work and working full time in itself. So, anybody who's pressured with time or is juggling a number of different things, I hope this kind of reassures you that, it can be done if you are short of time. That was kind of my reasoning and my timing of sitting the exams. In terms of how I went about preparing for it, I used kind of popular books such as Cases for PACES to revise for it, and also a book by Rupa Besant as well. Yeah, because they were, very tried and tested materials and weren't very expensive and very high yields for topics which come up. I also looked through the curriculum for PACES and IMT and looked at sample exam scenarios as well as a guide, as well as marking schemes to know what examiners were looking for. And I looked at official videos just to see what examiners wanted and spoke to people as well. And I used that kind of knowledge to help plan my revision. And I had another IMT1 who was also sitting PACES at the same time as me. So we went round the hospital and found PACES and just prepped with each other. There was a PACES group in my hospital. However, I didn't end up going to that because I think it just worked out that I had quite a few on-call shifts when it was running. And also when it was on, they were just doing lecture type tutorials. And I just felt that, me and my PACES buddy would have gotten much more of it out of our time by actually examining patients and testing each other. So, I picked and chose what I used then. And we also asked a few consultants who examined for PACES to help out with scenarios as well. And that was super duper helpful. There's also quite a few podcasts, the RCPE podcast, obviously is great. And there's quite a few other PACES podcasts which were quite good. And in my commutes to work, I just listened to that and that was an effective use of time. And there was quite a few online websites which had examples of people doing the examinations or doing consultation stations and then discussing the scenarios, which I found pretty helpful as well. So doing that, and I also have a very nice partner who was a very willing patient to practice on, and I just practiced every day with him, and he was very sick of it, and I think low-key felt stressed out as well, but that just helped with muscle memory. So I did that as well.
Yeah, I think what was interesting there is the amount of times that myself, having done PACES maybe 2 years ago, were agreeing with your strategies there, and I could hear Olugbenga agreeing with books you'd used or strategies you'd used for revision. And I think that idea of having a PACES buddy is, if it can be arranged, super helpful because, as you say, that feeling of being examined and being watched by someone you trust or respect or who's supporting you through that process is really the best revision practice. Yasmin, you've got the tricky task of going last, which maybe you'll say some of the same things again, but I actually think that's really interesting that the same themes are coming up of how people prepared. So just let us know again a little bit about how you chose when to do PACES and if there was any particular revision strategies that were useful for you.
Yeah, of course. So I sat mine in IMT1 and I was the second cohort of doing the PACES 23, the new adjustments that they implemented. I sat my MRCP Part 2 in September of 2023, so just at the start of IMT1. And then I was actually debating whether or not to do PACES next, because I felt quite tired after doing a written paper. And I think I was on stroke and neuromedicine at the time, and then I was rotating onto acute medicine, which is when the next diet of the PACES would have been. And I was torn with a very busy rota and doing PACES, or waiting until the summer when I was on my more chiller rotation, which is rehab medicine with dermatology. And then when I got asking around what others did, I think sometimes there is no real good time to do it. You just have to do it when you're in a training program. It's mandatory. Ideally, you need to complete it by IMT2. And when I was thinking about it, I know I'm quite keen on a Group 2 specialty. So having that under my belt and my exams done before applying would be so helpful. And when thinking about acute medicine, a lot of the stuff you see on clerking or on take, or when you're covering the wards on acute med, actually on PACES patients anyway. So it was kind of like revising every day. So in my head, I thought, let's try and sign up, see how it goes. I hear people need to do it a few times anyway, because it's quite a tough exam. So I thought I'd hedge my bets and just try and see, even with the rota. And I tried to sort of see each day as like, let me try and learn something from a patient I saw that day. And I found that an easier strategy, because even if I was doing the long days, the night shift, if someone said, oh, there's someone who came in with a murmur, or a renal transplant has come in, I'd try and take the opportunity to take 10 to 15 minutes out of the day to go and see them. So that was my strategy and my reasoning to taking it at that time. People might have thought differently and thought, oh, I need to do more book work. But for me, I learned better with seeing, and then I'd read up on it after. I learned better that way. Then with revision strategies, I'd sort of echo what the others said, really. I started off with asking a lot of people who'd passed PACES just gone, and those who did the PACES 23 diet, like in the time when Aparna did it. I asked around what they did, what they found helpful, and tried to sort of gather what I thought would be helpful for me as a learner, because it is quite different to your writtens. So what I found helpful was to start off with a book and website materials. So for websites, there's loads out there, but I signed up to PACES test, and I found that a helpful strategy with learning how to do the examinations. And then secondly, a sort of a core book. So my core book was my Cases for PACES. I thought it was not detailed enough that I get bogged down and stressed that I needed to learn absolutely everything from there, but a good starting point with common cases that come up in PACES for cardiology, neurology, or respiratory, and then using that on my acute medicine to try and find those patients, for example, with COPD or with aortic stenosis. So I found that helpful, and then I layered from there, similar to what Aparna did and what Olugbenga was saying. So listening to podcasts, so the RCPE, the pre-PACES podcast I found really helpful.
There is this, I think, is it medical league?
Oh, yeah, the leads,
Yeah, they had some very serious, just to remember now.
Yeah, it's really good. I found there was, in fact, so many resources. It's quite hard to cherry pick what was, what you had time to sort of go for. But I think once you get going, you sort of can realise what your weaker stations might be. So for me, that was neurology. And actually, I found cardiology could be more difficult than you realise. So I thought reading up on those and trying to find the online materials like Learn Heme or Ploughing Through PACES was another good website, quite helpful to refresh your memory on things.
Brilliant. And I think that idea of seeing your everyday job as revision is so important. And I think, Olugbenga, you said something about when you were actually in the station, it felt like you were just talking to your consultants, like you had been at work. And I think every time I got stressed, when I just came back to the fact that actually we all do this every single day and we don't get stressed about it because it's so normal, that helped me feel a little bit calmer. I think I did use that on exam day of just being like, I'm just going to try and be the best version of me that I can be at work. And that's all I can really ask of myself. So I think that's a really great strategy to have for both revision and kind of preparing for the exam day. Maybe now we can move on a little bit to talking about the exam day itself. So whether you had any surprises, any tips or tricks for approaching the exam day itself, and any strategies that you'd pass on to preparing candidates for dealing with those nerves on the day, maybe stations that they feel like didn't go well and how to recover from those. I know we said we were going to go around in the same order, but maybe if we reverse it just to give everyone a chance to say different things. So Yasmin, do you want to go first?
Yeah, so my exam was actually up in Scotland in Glasgow. So I'd travelled from London to Glasgow. So what I did is, leading up to the exam time, I actually took a couple of days annual leave before, and I travelled up 2-3 days earlier just to settle in. And also I was quite worried about trains or flights getting cancelled. I flew up and I stayed there for 2-3 days before. I was so nervous leading up to it, to be honest. And I feel like the week before there was so much I wanted to go over that I hadn't gone over, but I sort of had accepted what I do every day is hopefully enough, and what I know is what I know, and you can't anticipate what cases you're going to get on the day either. So I sort of tried to take it easy those few days before. And I went to the hospital a bit earlier, so about an hour earlier. There was a couple of other people there. We chilled in the cafeteria. And in terms of dealing with nerves on the day, I think just like you were saying about reminding yourself that it's what you do every day, what you see your medical registrars doing every day, trying to put that hat on, like what would they do? What would a consultant expect of you? And then in terms of surprises that you might get, for me, I found the consultation stations probably the most difficult, because 15 minutes to get a history and exam, to go through the patient's ideas, concerns and expectations, and also go through investigations and management plan with them is actually quite tight. But I think the patients that you're sort of equipped with are well trained or well versed to give you the sort of focused history that they need to give you, and not prolong the consultation as long as it needs to be. And I found that that was probably the bit that people should focus on practicing most. I think I didn't practice enough of that. Yes, being on take helped, but timing myself would have been a bit helpful. But I know in your day-to-day job, you can't really do that because a lot of people aren't as well versed as the patients there on the day. And I think avoid, in terms of surprises that might come up, a condition, or really being unsure with how the consultation is going to go or how to navigate through it. It's just going back to your basics. So I think for me, prior to entering the room, you get given a vignette, so what the patient's come in with, how old they are, and you have about 5 minutes to prepare. So I found going through specialty systems, I'd write endo, rest, neuro, and I'd write out my differentials for each one, and also sort of key questions I'd want to say to include or exclude my differentials. I found that really helpful with dealing with nerves or surprises. So at least it shows you're logical, what you do every day, and bringing it back down to your basics of, I have an algorithm and this is how I safely deal with patients I see every day, and I'm not forgetting or omitting sort of acute things that we should be identifying.
I really like that idea, and I think I use it in my day job as well, of when you have a moment where you're stressed, which is essentially what the PACES exam mimics, doesn't it? It mimics that extreme stress that you sometimes get at work from whatever reason, to have that system to fall back on, whether that be a kind of way of organising your thoughts around a differential diagnosis or a process of taking a history. It's to show that you have those systems to fall back on in those times of stress. And I think the idea of writing those out or having a way of remembering them in that kind of vital 5 minutes before you go in the station is a really nice way to make yourself feel safe and that you can deal with whatever comes up.
I also think the patients try to give cues as well. So it's picking up on patient cues and exploring them, whether that is a medical concern or a social concern, is all quite important.
Yeah. Aparna, did you have anything to add about your experiences on the actual day? Anything that went well or badly? Anything you'd change?
Like Yasmin, I went to the exam kind of centre. Mine was in Aberdeen, so we drove up the day before and stayed in a hotel which was quite close, within walking distance of the exam centre, just so that we didn't have to deal with, last minute cancelled trains or anything like that. On the exam day, I also went to the exam centre early, and my centre was very well organised, and they tried to keep you nice and calm. And then on the day of the exam, I felt randomly quite calm. I think the day before, I was just super duper nervous. I had chest pain, palpitations, I was super worried. I think I just, got the nerves out my system the day before. And then on the exam day, I was just like, you know what, I'll just give it my best shot. If I'm nervous, that's only going to hinder me. I just thought, it's better to go in giving off an aura of confidence and just showing what I know and just giving it my best shot. And, if it doesn't go as planned, then I can always sit it again. Loads of fantastic Ridges who I knew didn't pass first time. So it's not a marker of how you are as a doctor or your knowledge base or your acumen at all. There is some luck involved. So I was saying, just give it your best shot. It's not a marker of your self-worth or anything. And with each station, I think like Yasmin, I just read the vignette. I thought about, what the key issues are, what are the important things that I can't miss, and which the main safety issues here. And you just kind of go in be polite, friendly, ensure that you give off like a good first impression. And then if there was some stations where I was caught by surprise or I wasn't too sure what was going on, I just left that behind me. I just moved on and I just concentrated on what was ahead. Because sometimes, how you think you're doing isn't actually how you end up doing. There was a few stations where I thought I didn't do very well, but then I ended up getting full marks and things like that. So you're not a very good judge of your own performance at times. And here's the story. On my consultation station, I offered to check the pupils because the patient had diabetes, and I just thought, I'll offer to do it because I see the fundoscope there. And I thought that they would say, oh, you can just put it down, you don't need to actually perform it. And the heartbreaking moment was that they went and switched off the light so that I had to pedal. And I'm awful at fundoscopy.
It's tricky.
It's so tricky. And to be honest, I'd done a little bit, but I was kind of placing my bets on that it wouldn't come up. But whatever, it came up and that station didn't go well. But you can put that behind you and just move forward. Just taking each station as it is, thinking through key issues. And, the examiners, they're not looking for you to be perfect. They just want you to be somebody who can be a safe pair of hands, managing a DGH, managing take. That's the kind of vibe which they're looking for. And they just want to know that you know most things at a good level and that you'll be safe and competent. I think that's what they're looking for. And I try to remember that.
Yeah, I think that idea of having a moment or a station that you feel hasn't gone well and trying to move on from that is so hard. And I think a few things you said there, Aparna, about remembering that in that moment, you're not a good judge of how well it's gone. That's just your perspective and your very stressed, nervous perspective. And to try and put that aside and just draw a line and do the best for the next station is definitely a challenge, but it's one that I think would really help candidates in that scenario. Olugbenga, again, you've got the challenge of going last this time, but anything that you would want to share about your experience of the exam day, whether it be the physical logistics of getting there or the techniques that you use to face challenges along the way? We'd love to hear about it.
I work in Northern Ireland, so the implication of that is that I can't write my exam in Belfast, so I definitely have to cross the sea. So I flew down to Edinburgh a day before the exams, so that was a Friday. My exam was on Saturday and I stayed with a friend and very lovely family. So I felt at home eating my local dishes and the night. So that seems to probably calm the tension a bit. But I must say, the adrenaline rush, the tachycardia, they are all normal and everyone should feel that rush. So if you don't feel it, then I'll probably say there's something wrong with the sympathetic system. So on the exam day, I had my breakfast, but I could not complete the food because obviously I was a bit scared. And sometimes if you need to do things to slow down your heart, provided it's not going to harm your heart, go ahead and probably, so you need that composure on that day. So my exam was in the Royal Infirmary in Edinburgh, and I must say it's one of the most organized exams I've seen in my life. We was in OPD2 or so. That was my first time in the hospital, and I got there about 1 hour before like my other panelists. And we got there, I got to the station there, I was told it's not yet our time yet. So I had to go back to sit somewhere. And I had to probably just take a walk around the very big hospital like our Royal in Belfast here. I sat there in a place hoping to probably revise, but I could not. So I just felt just drink something and carry on as day goes. As opposed to Yasmin, Aparna, I don't like cardiology, but I love neurology. So I knew neurology is my rest station. But once I go into cardiology, I know it's going to be tough. And unfortunately for me, my yin and yang are both in the same room because they are both in station 3. So my intention was go in, smash your neurology, and then make do with whatever you get in cardiology. And that was what I did because I would know this is a systolic murmur, this is an aortic murmur. If you describe the murmur, I can tell you what it is. But the good thing about cardiology is the management is almost generic for PACES exam. And I'm sure Yasmin mentioned the LearnHim website. They have a very good resource for teaching you how to say things. And I practically wrote down the way I was going to say things for my cardiology station. For other station, I know I could probably rattle my way, but cardiology, I knew this. Once I picked that this is the systolic murmur, this is what I was going to say all through. And that was what I did, even though I lost about 7 marks, but I still passed. So
I think it's good to have those scripts to fall back on, especially if you know that's an area that you struggle with.
Then so on the real exam, went in my station one was, for most IMGs, sometimes I struggle with communication. So I had to do my best to ensure that I say things. But the simulators or the surrogates, they're quite good and well trained. And sometimes if you make mistake, they could probably ask you again so that they are sure of what you have said. And on that, if you can backtrack, or if you want to say, I'm sure of this, then you can carry on. And again, always remember grabbing advice if there are implications for you in the exam.
Yeah.
So once you get in, you get a big neck before you go into the room, write your plan. And for me, my review of system, I do it while fitting you. So I start from head and neck. So any headache, any seizures, and then I go to the neck, any dysphagia, chest, any cough, and then at the chest, then go to the abdomen, go to the muscles. So that's the way I look at you and do my review of system. And that was the way I factored out to do things. And Yasmin also mentioned earlier that you probably have to take the take as a station 2 and 5, which I think was very helpful because I never had a very close body. So what I did was when I go in, I'd say, I'm spending 12 minutes to see this patient. And I go in, pam, do all those things and come out and, do I have a plan? Yes, I have a plan. Because those are actually patients who are stable and who are patients that could probably be fit for the same day assessment unit. So you could always sort things out that way. And that's what you probably find in the exams also. And so for the exam proper, things went that way. And one thing I did was, in each of my 5 minutes in the VNet, I was asking for water. And they're very nice to us. So they just bring the water to me because my mouth would have been dried up. And I just use the water to water things, to wet things down, then before I go into the next session. So that was how things went. And we're hoping for the best and expecting whatever happens. And someone told me as a general rule that sometimes if you go in and feel you've not done very great in the exam, you probably will have passed that exam.
Maybe that's a good thing to remember on the day for those moments where you feel like you've done rubbish. Just remember, well, some people have said that that's actually an indicator they were asking you hard questions or pushing you hard.
Yeah.
And I think what you said there is quite interesting, Olugbenga, in that everyone is actually on your side on exam day, whether it's the staff that are organising the exam and bringing you water when you need it, or whether it's the examiners who are trying to give you the opportunity to share the knowledge that you hopefully have. So be led by their questions if you get the opportunity to be. And for the last part of the podcast, we just wanted to talk about your experience after the exam. And I know we've got 3 fab candidates here who all passed first time, so don't have the experience of getting negative results and how to deal with those and how to pick yourself up perhaps a next sitting, which is obviously a challenging experience. But I'll just give you a minute or 2 each to share the experience of waiting for your results, how you felt in that time, and if there's any last hints and tips that you feel we haven't covered that you'd like to share with candidates. So maybe if we go Aparna first this time.
So there was a bit of a gap. I'm sure it was the same for Yasmin and Olugbenga between sitting the exam and then waiting for the exam result. I know previously that people used to only wait like 2 weeks to kind of hear back, but because this is a new format, they wanted to ensure that the exam was standardized and appropriate and that the actual design of the exam wasn't faulty in any kind of way. So it ended up being that it wasn't until December that I heard back, and actually they didn't give us an official date, so I didn't know how long I was going to be waiting. So it was at the back of my mind. I kind of forgot about it, but I did prepare myself and I applied for the next sitting, and I hadn't revised anything, but I was kind of gearing myself up just in case if I did have to repeat the exam in the next sitting. And the kind of exam process was very stressful because I saw on a forum somebody mentioning that the status had changed on our exam from having sat the exam to results processing.
Okay.
And so on the Friday, I was just refreshing the website, just waiting for exam results. And it was just, I was so nervous on the day, and lo and behold, the results didn't get released on the Friday. So then I had the whole weekend of sitting like a nervous wreck waiting for results. And then Monday came and I was like, oh my God, it could be today. So I was just nervous all of that day. And then again on Reddit, they said, oh, I've gotten my results. And then that was it was an awful kind of feeling, super nervous. I tried logging onto the website, and because everybody was trying to get onto the website, it just wouldn't load. So I had it trying to load on my phone and then on my work computer. And so I was just a nervous bull for a good 1 hour, 45 minutes. And then I got the results, and it was good news, thankfully. But honestly, it was just, I felt physiologically exhausted after having been nervous for several days and just having to wait for that last moment. So I don't know what to say from that. Apart from that, it's a nerve-wracking process, and that, you know, there might be a delay from results processing to actually getting your results. And I think it's just best if you just apply for the next sitting whilst waiting for your exam results, because I actually didn't end up paying for the actual exam fee, but even if you do get that money back.
Yeah, I remember also going through the process of paying for the next sitting and then getting refunded when the results came through. So I think that's good for people to know that is the process, and that's quite commonly done for people going through this process. Also, I think it's interesting how long we probably all spent, and most people would spend, preparing for the nerves on the exam day and in the days before, but you don't think about the nerves and the stress involved in receiving your results, do you? But obviously a lot rides on that, and it's really tricky. Olugbenga, did you have any good or bad experiences with getting your results, or any last things you'd want to let people know who are studying at this point?
Yes, because I already knew from their email that the waiting period was going to be long. And when I was applying, I had to ask for my exams to be put in March, though I applied in November, so that my waiting period would not be so long. So that was one thing I did, and I gave them reasons because I have to plan for my rota and the likes.
Yeah.
And thankfully, they agreed to that. I got my exam date was March 9th. So finished the exam and things are going well. And in between that period, I had a meeting with my educational supervisor who was trying to write up my ESR, and I ticked all my boxes, completed my mini-CAC, CBDs, of cards, required training, and the only thing left was just for me to get the diploma. And so he told me, I remember here, he's a very good man, he's one of the neuropathologists here. He said, assume you have passed the exams until proven otherwise, because you've done your part, you've written the exam. And also, I need to flash back something. One of the girls that we wrote the exam with on my exam day, we were 4 males, 1 female. She said something that was very funny. She said, when we finished the exam, she said, this exam is tough. And we all agreed it was tough. And she said, but I will look at it as being the best mock exams I've written for PACES.
Yeah.
Such that even if I fail, I'm happy to pay another 657 again to write another one. And that was the mindset. She said that, and I picked it up. I was like, oh, this is what I was going to use. So I picked that and traveled back to Northern Ireland, and going to work, coming back. And then when I had the meeting with my ES, it was quite a prayer feeling, because that's just the last thing you need to get your outcome one, hopefully. And then a day before they released the exam, I just went in. It got to a stage, Google Chrome was saying your most visited website was in my RCPE. He had that ad, and I was like, oh my God. So when I saw that the result being processed, I was like, oh, it's going to be released soon. And if you cast your mind back, for MRCP 1 and 2, it's usually released, I think, on Wednesday. So I think Wednesday, Thursday. So I was thinking, oh, now that it's switched to being processed, hopefully they're going to release the result. And the result was not released. And on Thursday, I had another meeting, my induction meeting with my new clinical supervisor. And when we had the meeting, he asked, where are you with the exams? I explained to him, and he said, okay, I've looked you up, you're doing very well. Just get that process passed, and everything is fine. And I was like, okay. And I did not tell him that result being processed. So it was a Friday. I went to the mosque to pray, finished praying. And while I still pray, I was still checking. And after the prayer, I was going back to the ward. And then I saw that result released. And I never knew the way the result would be released. Just like the part 1, part 2, you just say pass. I was thinking you are going to see it when you download the whole result. So I just clicked to download. And then when I download, I just saw pass. And I was out of this world.
Yeah.
That feeling was different. I just ran into the world, and I told my other colleagues, one is INT, I just said, I've passed PACES. And within 10, 20 minutes, my clinical supervisor walked into the ward to get a view. Or, usually after the ward round, they call me in the evening to ask where we would take. And he came in and I said, Prof, I passed PACES. Oh, he said, congratulations, fantastic. Now you're a good man. And ever since, so many things changed. Your life changed because people tend to hold you more responsible. People tend to listen to you more, and they know that whatever you're saying appears standardized and that you're probably saying the right thing because you've gone through the rigor. So it was a life-changing event for me, and I'm very grateful for that day of April 5 when the result was released.
Congratulations. And I think it's quite a universal experience, isn't it? Like you said, talking to your professors or senior consultants, everyone remembers that day of finding out that they passed. So everyone would be absolutely delighted for you, I'm sure. Yasmin, just to end on you, any kind of personal experiences after the exam or any last kind of lessons you'd want to end on for anyone revising?
Yeah, just thinking back to my exam day, I think what I found really helpful, everyone's different though, but I find it really helpful to debrief with the others. For me and a couple of the guys who had just finished the exam, I think it was quite nice to hear that they also found it equally really tough and really hard. So you're not alone in it, because when you're coming out, like Aparna made a good point of kind of putting that station behind you, thinking what's next, and just trying to get the marks, do your best, put your best self out there. But when debriefing, I found that really helpful. And even just chatting with others who sat it in that PACES period or diet, hearing them, they also had some tough stations. And it's standardized for a reason. And it's like Olugbenga mentioned, like it's a tough exam and it's got a certain level of rigor to it. During that interim period, I saw on the RCP website, it told you sort of when the results would be released from, but it didn't tell you your exact date. And because of the new diet, it said anywhere between 8 to 12 weeks. So I sat mine at the end of the diet. So mine was March 24. So I sort of tried to block it out until at least from April or whatever. And it was nerve-wracking, but I thought, just kind of forget about it for now until they released the results early, actually, the weekend before. But they did it for half of the people who sat that PACES diet. I was at the end, so me and a couple of others hadn't heard, but all of our friends who sat early in like February had got their results. So we were so nervous, but ours still didn't say results processing. So for the week following, we were like constantly refreshing on the RCP, like waiting. And then when it said results processing, then it's like that agonizing wait of, will it be an hour? Will it be the next day? Will it be a few days? Yeah, so I mean, I have no top tips apart from I think I was just really just eager to know. Then I found out at work and then sort of let my team know, and yeah, they were very happy. I called my family. Yeah, just reflecting on it, I think there's always that certain degree of fear of failure, like fear of like, oh, if I find out at work, I don't want to open it at work. Like I was sort of debating if the email came through, would I open it when I'm at work or wait until I get home? But I think you never really know until on the day. I think I'm always like, I think I said to myself, now I'll wait until I get home. But I think even if I had opened it at work and I found out I had failed, I think a lot of people in the room and who you work around know it's a tough exam, and there'll be people there who have failed. So sometimes you get that support from people there, from what I've heard from others who've had that experience. And in terms of like final top tips, I think when you're applying, you do have the option to sort of put in any special circumstances. So I had put in that I'd preferably want the end of March because I wanted that extra revision period, but also with my rota, my March is a bit calmer. And they honoured that, which was really good. So I think that's good to know for others applying, because some people I applied with didn't know that. Have a good revision strategy. So I think asking others who had passed or who had even failed what they thought went wrong or right, you can always learn from others and think about what revision strategies they did would suit you. So things that I picked up from others that I applied was like trying to have a revision buddy, like Aparna and then mentioned, thinking about what books might suit you if you're a book reader, if you prefer websites or videos, or like Olugbenga said, he's a visual learner. And then identifying weaknesses. So for me, I knew neurology was mine. That was my fear. So I really tried hard with revising not only the book work, but also seeing as many cases as possible. And then I think the final bit that I didn't mention earlier is probably getting slick with your examination. So that's one thing I didn't really appreciate until I did a course in the end of Jan. So probably about 6 weeks before my exam, I did a PACES course. I'd read up how to do the examinations, but I wasn't slick enough, I don't think, when I did the course. And I think if I had have nailed down the cardio, rest, neuro, abdo exam, like the back of my hand, like I knew it, it was like no to memory, I probably could have picked up the clinical signs a lot better in those few minutes you have with the patients on the courses. I think that's what I'd recommend for people signing up for courses, or just make sure you're slick with your exams, then you're just there to learn the physical signs, which is what people tend to fail on.
Yeah, I think if you've got that pattern of examination, like without having to think about it, it frees your brain up to really look or really notice stuff that's in front of you. And there's courses where they do have patients that have rarer signs that are more difficult to see in our everyday jobs. It's lovely to have your brain relaxed on the physical steps of the examination to make the most of those signs in front of you.
For the examination, one thing I find, as Yasmin has said, is I would say don't practice completing the exam in 6 minutes. I would probably say practice completing it within 5 minutes, 30 seconds, so that you have 30 seconds to integrate your thoughts together before you face the examiners and you can start with. So what that implies is practicing such that you don't have to think about the next step. All I need is I've seen a feedback before where the examiner wrote that is very unpracticed. So that means that probably, and it was a neuro station, probably even the way the candidate was holding the tendon hammer. We know most of us don't do this, but we probably have to do things the right way and standardize our approach. And I try to say, okay, if you can get it done within 5 minutes, 30 seconds in your practice session, in the exam, you may be faster than that and you'll still pick all the sides and then things will go on with, but you don't have to think to examine patients. One of my consultants in my home country will say, it should be at the level of your cauda equina.
Yeah.
It does not need to get to your frontal cortex. It should be down below. So you don't have to think. Just go ahead and do it. And that's just what I want to add.
Yeah, to get those steps second nature is really important and really something that only comes with doing them what feels like a painful number of times when you're practicing. Yeah, thank you so much for sharing that. So yeah, thank you so much to the three of you. It's actually quite a vulnerable thing talking about your PACES experience because it, like you've all said, it's such a stressful time. So really thank you for taking the time and sharing your experiences with us. The last thing I'd like to reflect on is, and I think we've touched on it a few times, what kind of like a career defining moment, both preparing for your PACES and doing your PACES and the period afterwards is for all of us. And when you talk to your senior colleagues, everyone remembers that process. And I think, although maybe I wouldn't have said it at the time, there's something, a bit of a rite of passage and something almost enjoyable about gaining that huge wealth of knowledge and doing it alongside colleagues who then become friends because you've been through this really tricky experience with them, and then also being able to share that experience with your senior colleagues and, like you guys have, passing that knowledge on to people who are preparing. So thank you so much for sharing that. So good luck to anyone who is preparing at the moment, who's made the most of this resource, and we really hope you've found it helpful. Just to remind you that if you access any of the other RCPE podcast resources, there's many other episodes in our Demystifying PACES series, which might help you prepare for more specific stations in the exam if you're struggling there. And if you have an interest in particular clinical topics or other areas in medicine that are non-clinical, there's both the Clinical Conversations podcast series and the Career Conversations podcast series, which we'll hope you'll enjoy. Thank you again, and good luck to everyone preparing for PACES.